Welcome back to Ask the Expert. This time, we are sitting down with Dr. W. Keith Barnhill at the Pain Clinic here at Greene County Medical Center. Dr. Barnhill, first of all, thank you for being on with us today.
Oh, thank you for having me today. It's a pleasure.
Now, I've been made aware that you are quite the renowned expert in pain management. Tell us a little bit about your background and kind of what brings you here to Jefferson.
Okay, I'd like to summarize. First, I was a registered nurse back in 1983, and then I became a certified registered nurse anesthetist back in 1991, and then I started doing non-surgical pain management in 1996 after leaving the Army after 20-some years. After that, I practiced with two board-certified anesthesiologists. One specializes in physical medicine, the other was a rehab specialist. And I passed a board examination in 2001 by the American Academy of Pain Management. So that's my start. Then I started doing pain almost 100% and hardly any anesthesia. So I've moved over to the pain clinic full-time. I started an education company around 2001 to provide continuing education training for nurse anesthetists across the United States. This led to the first pain fellowship educational program for CRNAs. This was at Hamline University in Minnesota, so it's our first pain fellowship. I wrote 1/3 of the curriculum. I continued the academic teaching component, and then we transferred the program from Hamline University to Texas Christian University. Then after that, another university popped up with a pain fellowship for nurse anesthetists at the University of South Florida, which I still am affiliated with. I recently represented our national association with the CMS panel of 12 experts. What the CMS did is before they make rules on how they're going to pay or what you can see in the pain clinic, they determined that 12 experts must review the research, and I was one of those 12. I was the only non-physician on that committee, and I've been on it twice. So I helped them develop their LCDs for epidural injections, fast set injections. And I'm also a consultant to our national organization for issues that surround CRNAs and pain management. So that should summarize in a nutshell.
Wow. I'm just, all I can say really is wow, and we're excited to have you here in Greene County and at Greene County Medical Center. It's pretty safe to say that once you got into pain management and looking at pain clinics, it's become a strong passion of yours. Tell me a little bit more about what a pain clinic is.
Well, that's a very good question. A pain clinic is usually a designated area of a hospital or an office where patients are interviewed, their personal pain experience and records are reviewed, and then a pain assessment an individualized pain assessment is done. Additional components of this pain assessment include the physical exam, review of any of their diagnostic testing, eventual recommendations of a treatment plan that is mutually agreed upon by the patient, their provider who is referring them, and any supportive family and significant others. It's a group assessment. This usually followed by therapeutic interventions, which will be like medications, injections, or some form of therapy. It can be psychological or physical therapy.
Definitely sounds like a full team approach to that. Tell me a little bit about the circumstances that somebody would come in here at Greene County Medical Center as a referral to you or Dr. Richard Jacobson.
That's a good question as well. The majority of people in pain will have usually acute pain that will resolve on its own or with some conservative therapy. Conservative therapy is like anti-inflammatory, muscle relaxers, ice, heat, even physical therapy and chiropractic care are under that realm. If it does not, or if the pain is not relieved, then a referral to the pain clinic is then indicated. The primary care providers are very good at treating the sprains, strains, and low back pain, headaches, and similar common pain syndromes that are seen. A referral to either of our pain practitioners would be recommended if, one, pain is unmanageable despite all these conservative therapies we talked about, or during the rehabilitation phase after a major surgery or injury, any acute pain syndrome that has not subsided, it hasn't gone away on its own within 30 days. Examples would include neck pain, back pain, joint pain such as shoulders, hip, knees, certain headaches, nerve pain, and muscle pain.
So this definitely sounds like something that's trying to be addressed at your primary care. But then if you're not able to get it resolved there, a lot of great resources are available here at Greene County Medical Center to help with that. Tell us a little bit about some of those treatments that you use in order to help patients manage that pain.
Okay, let's start in the beginning. First, we offer a pain assessment that determines the type of pain that the person is experiencing. This includes a personalized diagnosis, treatment plan, and education on the underlying pain problem. Common interventions include epidural injections of the neck, back, and tailbone, joint injections and radiofrequency ablation of small, painful sensory nerves of the spine, shoulder, sacroiliac joint, and knee, trigger point injections of the offending muscles, diet and exercise. We also monitor the person's progress and help guide them to a path of healing or a more tolerable pain experience and hopefully a better quality of life.
And I think that's the key point there, right? Is everything you're doing is trying to get to a better quality, pain-free way of living. Now, the pain clinic here at Greene County Medical Center began seeing patients just about a year ago. What kind of changes have you seen in the last year since the clinic came online?
Well, first, we're fairly busy, and we've actually opened up more clinical days. We started out 2 Fridays a month. Now we're at 4 Fridays a month. We've gone from 2 a month to 4. We've added radiofrequency ablation techniques, which are a little more sophisticated, to burn and dehydrate painful nerves. And we continue to work with the rehab specialists, the chiropractors. We try to work in collaboration with them as well as the primary care so that our goal is to alleviate eventual pain and suffering.
Wow, really are trying to work with all areas of the discipline in order to make sure that somebody has a pain-free life that way. You know, as you look to the future, you shine that flashlight ahead. What kind of additional additions do you see in the upcoming months for the pain clinic?
Well, we do continue to add fluoroscopic and ultrasound-guided procedures. So we have special machines to provide the various type of specialized injections we do. There's a thing called regenerative therapy where they include plasma cells and stem cells inject into the joints. That's not far off. The only thing the drawback that's holding it back is the financial carriers, the insurance companies are holding us back. But we're still watching the research. Rich Jacobson and myself continue to go to these continuing education courses in regenerative therapy as well.
You know, as I'm listening to you and processing what you're doing and how you guys are doing it here at the clinic, we are blessed to have such a renowned physician here, as well as just the service that you're providing. So first of all, I want to just stop for a minute and say thank you for bringing that service and being here in Greene County. It definitely helps our community.
Oh, you're welcome. I appreciate being here, and I appreciate your nice comments about us.
So as you know, as the public is hearing this and they're saying, okay, how do I go about taking advantage of these services? I've been struggling with pain for a little bit. How does patients go about getting an appointment here with the pain clinic?
To get an appointment, basically consists of a primary care provider making the recommendation to the pain clinic. Ideally, all patients should have a relationship with their primary care providers who actually initiate the conservative therapy. They do the diagnostic imaging and workups and determine if the person is a candidate for the pain clinic. We work very closely with the primary care providers. I believe once we have all the person's medical information, their health history, lab, and any radiological images, we contact them with a scheduled time for a consult and eventual treatment. If the person is already established with us, they can contact our office for a follow-up appointment.
So it sounds like the first place a listener is going to want to start is with their primary care physician, is what I hear you saying that way. And then from there, we'll look at a path of treatment that makes the most sense.
Very good. Yes, exactly.
Now, as we kind of prepare to wrap up here, is there anything else you'd like to add? Anything else you'd like to inform our listeners of?
Okay. Well, first, it really takes a village to treat someone in pain. That's why a person experiencing pain will have to undergo a thorough examination before being treated in a variety of ways and by a variety of specialists. The ideal pain treatment is prevention. Try to keep the body moving, stress and tension in the body low, and keep the body weight under control. Remember to warm up before any exercising. Get plenty of aerobic exercise, even if it only consists of walking, and cool down the body after any physical exertion. If you do develop pain, see your primary care provider and keep us in mind. We are here to take care of our community.
Dr. Barnhill, I can't thank you enough. And yeah, I think if I had to summarize, my quick answer would be pain is one of those ways that your body tells you that something is wrong. And maybe first and foremost, if you're experiencing pain, go see your primary care physician. Dr. Barnhill, thank you very much for your time. We appreciate you coming on Ask the Expert today.
And thank you for having me. Great to be here.
You've been listening to Ask the Expert, where we've been sitting down with Dr. W. Keith Barnhill at the Pain Clinic here at Greene County Medical Center. We'll be back with more on Raccoon Valley Radio.